I'm Dr. Rachel Miller, physical therapist and certified Pilates instructor, and I want to talk to you about pressure issues. So these are including things like diastasis recti, which is abdominal separation, prolapse, and also stress incontinence, which is leaking urine with sneezing, laughing, running, coughing, jumping, those types of things. That is not a normal change in the body. That is a sign that the pelvic floor is not doing its job. We're going to save that for another post. But for today, we're just going to talk about that pressure system. So I have my little mermaid here to demonstrate with me. So your deep core system, we have your diaphragm at the top, we have your pelvic floor at the bottom, we have your deep abdominals in the front, and we have your deep back muscles in the back. And so if she's doing something strenuous and she's holding her breath, then there's going to be extra pressure in the system. And either that pressure is going to go down onto the pelvic floor or out on that abdominal wall. And so what happens if she's holding her breath and also kind of drawing the abdominals tight, that pressure goes down on that pelvic floor, which is not great if you have pelvic organ prolapse, and also can promote that stress incontinence, right? So that leaking, that's going to promote that, right? If you're doing something strenuous and those pelvic floor muscles are tight and you're holding your breath, then the pressure is going to go out on that abdominal wall, which is going to hinder that abdominal separation from coming together. So the good news is a lot of what we do in physical therapy and what I also do in my women's wellness Pilates class is teach you how to manage this pressure system, meaning everything should be moving together. We shouldn't have these, things happening, right? And so a lot of that is just education and knowing how to use your body in a way that's cohesive and knowing how to use that deep core system, which gives you a nice functional core, which can also help issues like ongoing back pain, hip pain, things like that as well. So learn how to use that deep core functional system